Did you actually know that dysmenorrhea, or what we sometimes refer to as menstrual pains, affect 80-85% of women in their lifetime? This pain sometimes becomes too much that it affects the routine and the daily activities of these ladies. We are going to look at what we actually can do in the comfort of our living homes to reduce pain, or to at least manage the pain to a minimum level where it can allow us to continue and do our own activities as usual. But before we go into that, we need to understand how does this pain come about. We need to understand that every month the lady's womb, or what we call the uterus, prepares for fertilization of a baby, and therefore it stores food reserves inside the uterus to be able to feed the baby that may come anytime. So when this doesn't happen, when fertilization does not happen, then this stored food is going to be shed in the form of blood, and that is the menstruation, or that is the menses that we always see every other month. So how come that there is pain during the shedding of that inner wall of the uterus? What happens is this: when there is no fertilization, then the ovary releases what we call prostaglandins. Now, these prostaglandins cause the walls of the uterus to contract. Now, when they contract, because they are contracting, they place, or they congest the blood vessels that is bringing blood. And remember, this blood contains red blood cells that store oxygen. And therefore, there is going to be little oxygen that is reaching the walls of the uterus. And therefore, when there is little supply of blood and little supply of oxygen, it is going to cause that pain. There are two types, or there are two forms of dysmenorrhea, or what we call two forms of the menstrual pains. We have what we call primary, and we have what we call secondary. The difference amongst them is that in primary dysmenorrhea, there is always no damage in the pelvic region. In other words, the pelvic organs have no damage. But the pain is just due to the physiological process of the menstruation. So the organs that are in the pelvic region, the uterus, the fallopian tubes, the ovaries are always intact. They have no any damage, they have no problem. And then in secondary dysmenorrhea, this is as a result of damage, or when there is pathological issues with the organs in the pelvic region. So such issues or such disease can be like fibroids in the uterus. There can be endometriosis. Endometriosis, this is where the inner lining of the uterus implants itself somewhere else, not in the inside of the uterus. There can also be things like ovarian cysts and so many things. We shall go into details of that in the next video. So that is the difference between primary dysmenorrhea and secondary dysmenorrhea. The way you can differentiate between them is, in secondary dysmenorrhea, sometimes you feel the pain during the menses, and even after the menstrual period, such pain continues. So it is telling that the pain is not actually only due to menstruation period, but it is due to another cause, and sometimes can even occur before the menstrual pains, before the menstrual periods, but it normally worsens during the menstrual periods. Now, we want to understand, what can we actually do to reduce this pain? Because at times it becomes high, it becomes very intense, and that it interferes with our daily routine. It interferes with the way we do work daily. So what are the things that we can actually do at the comfort of our living homes to reduce this pain? The first one is exercises. Now, someone out there is saying, this guy is joking. How do you tell me I have pain and then you tell me to do exercises? We are not talking about heavy exercises. We are talking about things like jogging, things like taking a walk, things like maybe riding a bike, things like doing a yoga, something that makes your body active. Now, what happens is that when you do exercises, your body releases what we call endorphins, or what sometimes is referred to as the happy hormones. So when it releases these endorphins, when they reach in the body, they raise your mood, and therefore you feel a little bit relieved and you feel a little bit happy and relaxed. So exercises are really very good in reducing this pain. We recommend that you at least do 30 minutes of the exercises daily for the period when you are in your menstrual cycle or in your menses. The second thing that you can actually do is what we call hot water massage. How do you do this? You can use a hot water bottle, you heat it, or you put in hot water, and therefore the bottle is warm, and then you apply it on the lower abdomen. But make sure you don't put it directly into the contact of the skin. Put something in between, like a towel, like a t-shirt, so that it doesn't really come into contact directly with you, because it can actually burn the skin, and which is not really going to be a very good stuff. The next thing that you can actually do is you can take some medications if the pain is really worse. Now, some of these medications, we have what we call over-the-counter drugs. We most times refer to them as NSAIDs, or non-steroidal anti-inflammatory drugs. The commonest ones are ibuprofen, diclofenac, tranexamic acid, methylenic acid. So you can use some of those drugs, but then you need to be cautious before you use them. Talk to your health worker so that you know which exactly you should use, because it is not supposed to be used by some categories of people. For example, if you have a liver disease, a kidney disease, or you are a person with chronic ulcers, you need to consult your health worker before you can actually go on and use these NSAIDs. But if it's worse, then we recommend that you can use some of those drugs. And then lastly is what we call food supplements. Whereas the mechanism of action is really not very clear, but research has actually proven that most of these supplements, like potassium, like vitamin B complex, like vitamin D and magnesium, can actually go a long way in reducing this pain, and it can give you a better feel when you really use them. And the last point is positioning. Now, research has shown that when women assume some certain positions, most of the times when they sleep on their back, or when they clench their knees and bring them to the stomach, it sometimes gives them some relief of the pain. So we advise that you assume a position that makes you feel comfortable, and therefore makes you a little bit feel okay. And then maybe you can also take a hot shower. A hot shower will help relax your muscles. And when your muscles are relaxed, remember we talked about the contraction of the uterus. So when this time around your muscles are relaxed, then it feels you a better relief from the pain. So please, if you have enjoyed this video and you want to see our next videos, please hit the subscribe button below and the notification bell, so that you can always be notified every other time that we release a video outside there. So thank you for watching.